My name is Jasmine Cooper, and I'm the project advisor for the Center to Champion Nursing in America and our Future of Nursing Campaign for Action. And I'm so happy to see everyone here today. Thank you so much for your patience as we dealt with some technical issues, but I'm so glad that you could join us. I have several roles today, and one of them is serving as your MC. So for those of us in the room, I'm sure that you're still picking up your bento boxes or grabbing some refreshments, but I just want to welcome you and thank you so much for taking the time to join us in the building today. I also want to take the time to thank our sponsors, AHIP, the Joint Commission, Leapfrog, and the United Health Group, who helped make today possible. I'd also like to share some housekeeping items and then give you a little background about our history in this space. So starting with the space, we are in the AARP Innovations Lab that we call the Hatchery. The Hatchery was named after a historical moment that was launched with what we know today as AARP. In the 1950s, Dr. Ethel Percy Andrus, a retired principal of Lincoln High School in Los Angeles, learned that one of her retired former teachers was struggling financially with her health. She went looking for this woman and found her living in a chicken coop. When Dr. Andrus realized the retired teacher's plight, she understood she needed to act. Soon after, she launched the National Retired Teachers Association. Once this was underway, she realized that it was more than just retired teachers who were struggling to get health care and meet ends meet. So in 1958, she launched AARP. Her ideas were innovative and her actions were radical. They helped tens of millions of Americans 50 plus over a 60-year span. AARP continues to innovate, and we remind ourselves of our origins with this designated space of the Hatchery. Here are a few more practical things to know about this space. If you haven't already done so, you can hang up your coats directly behind you in our room, and you can also pick up your lunch near the kitchen. To my left is the hallway for the restrooms. And I think that's all of our technical or housekeeping tips that I have to give you. After the main part of our program wraps up, we will stay in the Hatchery for a reception. The back area past the elevators is where the reception will take place, so we hope you all can stay. I also wanted to let you know that we have several hundred people joining us online today. Thank you so much for your patience. Okay, so with those things out of the way, it's time to get started. First, we will have a videotaped welcome from AARP's CEO, Joanne Jenkins. After that, Rear Admiral Aisha Mix will provide a keynote and have a fireside chat with our Chief Diversity Officer, Edna Kane-Williams. Following the keynote and fireside chat, we will have 3 different panels. Please refer to the bio handouts that you've received today, and you can access them online under our resource tab. The 2 senior vice presidents responsible for today's program will also provide closing remarks and a call to action. So at this time, I want to thank you all again for joining, and here's Joanne Jenkins.
Welcome to Building Equity in Nursing and Healthcare Leadership. We're excited to host this Health Equity Summit along with the Future of Nursing Campaign for Action, an initiative of AARP Foundation, AARP, and the Robert Wood Johnson Foundation, because building equity in nursing and in healthcare leadership is an important priority for AARP. We understand that fighting disparities is core to our mission to empower people to choose how they live as they age. The fact is, everyone benefits when health and income disparities are eliminated. That's why a key goal of our enterprise strategy is to eliminate disparities that have blocked economic opportunities for some Americans and have left others in poor health, even shortening their lives. I want to thank Dr. Jean Axius, our Senior Vice President for Thought Leadership, the Disparities team, and Dr. Susan Reinhardt's team at the Center to Champion Nursing in America, and especially our co-executive producers for this event, Mary Anderson from AARP Illinois and the center's Winifred Quinn. I also want to thank our national event sponsors, AHIP, the Joint Commission, the Leapfrog Group, and United Health Group for their valuable help and support in putting this conference together. I'm certain that today's conversations will ignite and accelerate much-needed changes in the field of nursing and advance the cause of health equity. These changes we talk about today will not only benefit nurses and the patients they serve, but also the health and well-being of the population at large. AARP has a long commitment to health equity. In 2007, AARP Foundation, and the Robert Wood Johnson came together to establish the Center to Champion Nursing in America. The center's goal is to ensure that all Americans have a highly skilled nurse when and where they need one so that all Americans can live a healthier life. Since then, with Robert Wood Johnson Foundation's generous support, AARP has worked hand in hand with the center to strengthen the nursing profession. We highlighted the critical role nurses play in creating a healthier nation and advancing the cause of health equity in our country. During the pandemic, millions of Americans came to realize how vital nurses are to the health and well-being. And last year's release of the National Academy of Medicine's Consensus Report on the Future of Nursing 2020 to 2030 reaffirmed the importance of strengthening nursing capacity and expertise to the achievement of health equity. Today is devoted to understanding how a diverse nursing workforce and nursing leadership will help achieve health equity in this country. You'll hear from an all-star cast drawn from the highest levels of government, healthcare, and the nursing world. The first panel will focus on the importance of a diverse nursing workforce. The second will concentrate on the value of diversity in nursing leadership. We know from our own experience at AARP that having leaders in our organization from underrepresented communities generates systemic change. In that vein, diversifying nursing leadership is important for the profession and for the country as a whole. Diversifying nursing leadership will drive diversity and inclusion not just at the highest levels of the profession, but at every level, rippling through the patient population to increase health equity throughout the nation. It's crucial to hear directly from the nurses on the front lines about their experiences and perspectives on diversity. That's why I'm glad to see that both panels focusing on diversity and inclusion in the clinical settings have a staff nurse on the panel. On behalf of AARP's nearly 38 million members, over 1 million of whom are active or retired nurses, I'd like to say a heartfelt thanks to you and your peers who care for patients and their families day in and day out. We owe you a huge debt of gratitude. I also want to give a special shout out to the 45 state action coalitions who are with us today. Most of you are remote, although we do have some local leaders here in the room with us. For those of you who are not familiar with the action coalitions, they are the Future of Nursing Campaign for Action state and local leaders and grassroots folks who work with the Center to Champion Nursing in America to ensure everyone in America can live a healthier life. They're the ones that really make things happen at the state and local level. Many of our state action coalition members work with AARP state office advocates to change laws so that consumers can have direct access to nurse practitioners and other advanced practice registered nurses. For example, after West Virginia changed their advanced practice law, the West Virginia Action Coalition created a program so nurse practitioners could open their own offices in rural areas. Last year, the West Virginia Action Coalition also received $1.3 million in federal grants to train nurse practitioners to open their own practices, giving many more people access to health care. At AARP, we believe all people should be empowered to choose how they live as they age, and building equity in nursing and healthcare leadership is essential to achieving that goal. It is my hope that by bringing all of you together today at this conference, you will not only set us up on a course to achieving health equity, you will be contributing to the overall health and well-being of the nation. Have a great conference.
I want to thank our CEO, Joanne Jenkins. Also, you just saw a lesson in agility. We have to, go with the flow. So thank you for, for hanging in there with us. I'm also in the uncomfortable position of correcting our CEO because we have a very esteemed person as our keynote, but Joanne referenced the incorrect name. We're actually, and I'm delighted to introduce her, and I'm looking so forward to our fireside chat. But with introducing Rear Admiral Aisha MIX. And I told her I wasn't going to read her entire bio. That's available, I believe, in both your handout materials and online. But very, very esteemed background, and it's so my honor to be a part of this conversation today. But Rear Admiral Aisha MIX is Chief Nurse Officer and an Assistant Surgeon General in the U.S. Public Health Service. We welcome Rear Admiral MIX. It's indeed our pleasure to have her here with us. She is going to give us her views on both the administration's perspective on health equity and diversity, equity, and inclusion, but also what she sees as real solutions and recommendations for how we can move forward with the specific focus on the nursing profession. So thank you so much for joining us, bearing with our few technical issues. Come up now, give your keynote, and then I'll join you later for our fireside chat.
Good afternoon. So in the public health service, we say semper gumby, always flexible. We can adapt to most anything because it seems that every time we absolutely need to do so. So I'm okay with this. So it definitely is my pleasure to be back with you today. It is both a timely and critical conversation. And I say timely because just yesterday I actually met with a colleague who said, Aisha, when I'm out and about, I tell people about you, right? And what he told me is he was up at a medical center locally and he saw some nursing assistants and he told them, do you know that you can be a registered nurse? And they just kind of looked at him and said, whatever. And he said, no. I want you to know that I know the chief nurse of this nation. And they're like, you know my chief nurse. No. I know the chief nurse. As a matter of fact, Google her. Now, what happened after that was really impressive because the young lady's eyes got big and she said, oh my God, she's a black woman. And then she said, and she has a black name. And then she said, and she wears locks. Now, true story, the nursing assistant's name was Aisha. And when he told me that story, I said, can you please give her my phone number because I need her to know that she can absolutely reach to me because from one Aisha to the next, you can be where I am. And I really think that is the theme, and the conversation that really sets the stage for everything that we'll talk about today. So, I'll start with kind of, where we are as far as the administration, and I'll be the first to say we still have work to do as well, but then move into the fireside chat to share a little bit more Aisha-isms, as I like to call it. And it's funny because I tell people I actually am the first chief nurse with locks. So I will go down in history as that. So, equity in nursing and healthcare leadership absolutely begins, as I said, with the ability for people to not only see, but to believe and to know that they can advance and they can achieve themselves. And so when we look at what that means for our current administration, much like many of the government-wide initiatives that are in place, many begin with an executive order, because that's what happens to really get everyone on board to what's happening. So the executive order that you see on the screen now, it's Executive Order 14035, and that was actually introduced by President Biden in June of 2021. And what it did was highlight the need for the federal government to have an increased focus on diversity, equity, inclusion, and accessibility, and be a model for the rest of the country and how we integrate this in establishing a diverse workforce as well. So as we're aware, and as is indicated on the slide, we all know that when you focus on these elements, there's a direct connection with having a high-performing organization itself. So in looking at what the executive order actually required across our agency, it actually called for the development of a government-wide strategic plan, right? Again, to get everybody on board on the same page for what we needed to do. And so this strategic plan was created to give a resource, because again, not everyone is at the same place in order to address these things. So disseminating information related to establishing leadership, providing technical assistance on how to get there, and also guidance to agencies in order to develop their own plans as it related to DEIA. So in addition, the agencies were charged with creating their own strategic plan. Again, if you don't provide someone with a deadline, it might get done or it might not. So they actually had a deadline to establish their own strategic plans by March of this year, right? And so what this would do and what this was intended to do was to make sure that the agencies assessed where they were at the time of the executive order, where they needed to be, and to consciously address those barriers that were in place that were in the way of them getting to where they needed to be to address the DE&I plan for the administration. So I'll share a bit of some of the priorities that came out of the report. And this report is public, by the way. So there's a link, and hopefully this slide will be available to you, but you're welcome to look more in depth. But just to give you an idea, so safe workplaces, it's exactly as it sounds, right? So at this point, we're looking at how the agencies address workplace harassment, in making sure that people feel included and welcome in these environments. It also looks at prevention programs, and not just establishing the program, but actually monitoring it to make sure that it's actually doing what you thought and what you intended for it to do. Establishing the role of a chief diversity officer, or calling it something else, but still having those same responsibilities, because you have to have someone who is actually held accountable for making sure that you're following your plan, right? Because it's that age-old thing. If it's everybody's job, it becomes no one's job. So you make sure that it becomes someone's job to keep the agency or the organization accountable for what you say is supposed to happen. A conversation of data collection, right? We all know this to be true, right? We can anecdotally create all kinds of scenarios, but if you're not collecting the appropriate data, you can't tell the true story. So it's a higher emphasis on data collection and the self-reporting of demographic information, because how can you say that you've had an impact on a particular population if you haven't collected the data that actually tells that story, right? Paid internships, and this is one that sometimes people overlook, but consider that if you are in a position that you have to choose between an unpaid internship to gain valuable experience or an unrelated paid job opportunity, who's left at a disadvantage, right? So how can we as the federal government create more paid internships so that we have a win-win situation for those, especially from underserved populations? Partnerships and recruitment that actually build into a more diverse pipeline. Where are you recruiting from? Where are you creating a pathway from, right? Because we don't often talk about pathways, but where's your pathway starting? And is it starting in the right place in order to actually achieve the outcomes that you're intending for it to achieve? Advancing equity and transparency and professional development and advancement, right? We can point to organizations and we can say, show us your leadership and we can show you your diversity. Well, that's all well and good. However, how did they get there? And how are you intentionally looking to change that, right? So again, equity, transparency, and how people move, especially up through your organizations. Expanding the DE&I training and learning, not just for education purposes, but to actually equip people with the tools that they need to almost be the trainers, right? You don't want people to just take it, but you want them to take it, share it, and work within it. Advancing equity, also for employees with disabilities, as well as LGBTQI+ individuals and their families, making sure that everyone sees themselves as a part of this federal family and that particular agency. Looking at pay equity, If you take a gander at who's holding what positions and what those jobs actually command, so where we left off was really looking at barriers that exist for certain populations, and for example, those who have been incarcerated or those who have past convictions. Where do we have unnecessary policies in place that actually prevent them from actually being a part of our society and being impactful? So I'm going to move through a little bit, especially because on the next couple of slides, the resources are actually available to you to read more in depth. But what I wanted to share is when there is a government-wide mandate that mandates agency action, the agencies share the love among those departments and divisions that fall within the agency. So HHS actually has our own strategic plan. And within that strategic plan, there is a focus, as you see on the screen, related to Objective 5.3 that talks about upholding, the innovative and effective human capital resource management. And it really is a look and a driving force at how we address diversity, equity, inclusion, and accessibility across each of the agencies. And as I said, each agency within HHS was also mandated to create their own strategic plan. So 3 examples I show for you on the screen now: NIH, CDC, and FDA. Those are publicly available, and you can read a bit more about how they approach it, because just as each agency has its own culture and purpose, each agency has to address these areas in slightly different way. The HHS Health Workforce Strategic Plan, I also wanted to include here because if you've listened to what I've said from the beginning, at no point did I mention the word nurse, right? None of those efforts are specific to nursing, right? But what I say is that, through HRSA's coordination, HHS did develop a health workforce strategic plan. By virtue of the fact that we are the majority of the health workforce, I accept this as our plan. I've decided it's our plan, right? And I'll come back to that in just a few moments. I also would be remiss if I didn't mention some of the work that we're doing within the Commissioned Corps of the United States Public Health Service. So in addition to serving as chief nurse, I also serve as a senior advisor for our Minority Officers Liaison Council. And so this is a council that was created in 1990 by then Surgeon General Antonia Novello. And what she realized is that there needed to be a direct communication and a direct line between the Office of the Surgeon General and the officers in our service that represent these minority groups. And what she envisioned is that collectively, the MOLC, as we call it, would be able to share those shared issues, but at the same time, balancing the ability for each of the individual groups to actually bring forward the issues that resonated for them. So we've got 4 groups. And I always refer to them as the acronym because I'm federal, right? So we've got the American Indian Alaska Native Commissioned Officers Advisory Committee, affectionately known as ANCOAC, the Asian Pacific American Officers Committee, also known as APOC, the Black Commissioned Officers Advisory Group, BCOG, and the Hispanic Officers Advisory Committee, HOAC. So separately, each of the groups actually is engaged in community work, both to really reach the members of their community in a way that can be received, but also for recruitment and retention purposes so that we can increase diversity of our service. So as an example, BCOG, I actually used to be a voting member within BCOG, and on the recruitment team, BCOG actually created an initiative for historically Black colleges and universities, and they have a goal of reaching every single HBCU in this country in order to inform about public health service, to make sure that we have a more diverse workforce where we are. They were able to conduct in-person and virtual presentations since 2020, and as a result, they reached over 600 attendees. And amazingly, we're able to bring on 150 new officers to our service who also became members of BCOG. So when you talk about representation out in our communities and seeing people who look like you, who talk like you, who have shared experiences like you, this is important. And so some of our newer initiatives, for example, APOC, is in the community, and when they're out providing care and services, they're also making sure to address those who are part of the Asian and Pacific Islander communities in order to increase their awareness of the public health service as a career opportunity. So I say that from the very top at the White House, all the way through HHS, all the way through the op divs and the staff divs, and down to each of us, we are all in action. So I'll close on this slide that if you remember from May, I actually shared with you there, right? Because it circles back to where I said that I accept that HHS Health Workforce Plan as our own, because we all have a place in this. Every single one of us has a role, right? So when you look at the way that this falls out, it takes every single nurse in the nursing workforce to find and elevate their authentic voice. The work environments have to remain inclusive within them, right? So that those voices can actually be heard. And then we've got to develop and mandate those policies and programs that strive for equity in not only practice, but in nursing education, in nursing regulation, and also in nursing leadership. So again, I say we all have a role to play. And if by the end of this day of panels and conversation and discussion, if anybody in the room or online is still unsure about what role they might be able to play, let's talk. Let's talk. Because I really believe by the end of today, we all will be energized. We will all find a place in this. And I look forward to the discussion that's to come in just a few moments. Thank you all.
I'm almost afraid to test this. Testing. Okay, good. And you are unflappable. Thank you so much for your
Absolutely.
being able to adapt. So let's move the conversation a little bit more closely to the nursing profession and how you see diversity, equity, and inclusion and the whole landscape. We know that there's a lot of concern, frankly, of people, consumers like myself, especially communities of color, as they interact with the healthcare system. And given that nurses, I think, compose, I read somewhere, the largest percentage of healthcare professionals in terms of, who consumers are likely to interact with. How important is the notion of cultural cohesion? Or you mentioned it in your talk just now that people see people like themselves in the healthcare setting.
Right, and cultural cohesion, I'm going to take these off, right? So up there, I needed to see close and far. I'm okay here. But so cultural cohesion is a really good conversation because I think there's a part of it that exists on an individual level, right? Mm-hmm. So there's the notion that an individual nurse finds themselves a part of this profession, right? I belong here. I am valued here. And so when it comes to organizations, it is the ability to practice the way that you see fit, right? Because as nurses, we are joined in this profession that exists to be patient advocates. And the patient might be an individual or a population, right? And what we do best and what we are subject matter experts in is understanding that patient or population's experience. And so if we can all get behind the fact that each of us are driving towards that, we can then respect and understand that we might have different roads to get there, right? So that's the individual level. When it comes to the organizational level, now we're talking about the nursing profession. Right. And the same things have to happen for the profession as they do for the individual. So in a healthcare team, the cohesion comes from understanding the role that nurses and nursing bring into this healthcare environment. And so respecting it and celebrating it, right? It's the same concepts that we talk about when we talk about diversity, equity, inclusion, accessibility. Imagine applying that to the profession. And you'll understand why the profession is struggling in much the same way that individual nurses are.
So do you see solutions for this struggling? And I wanted to start with, were you at all surprised, I think I know the answer to this, that during COVID, really the belly of the beast, if I can use that term, of our healthcare system was really laid bare in terms of seeing how different the experiences of communities of color can be when they enter a doctor's office, when they enter a hospital, an ER, when they're trying to communicate at a very vulnerable point. I don't imagine that you were surprised, but what solutions do you see that nurses can bring to this very fraught situation? Right,
and as a public health nurse, there was no surprise for me. Not even a little bit. And, it was nice doesn't seem to be the right word, but it was nice to finally have others be able to see what we see every day and what we already knew to exist. And so one of the early issues that we had with the COVID pandemic as it related to communities of color was the exposure of the lack of communication that reaches the populations that need it most.
Absolutely.
You know? So even within the public health service, I remember early on, I was on a call, and I actually had an officer ask me, they said, Admiral Mix, so we're hearing that Black people can't get COVID.
Oh.
Is that true? Where in the world?
Yeah.
You know, and if you think about it from a science background, you understand that that doesn't make sense. What made sense, though, who you saw on the television were not people of color that were impacted in the beginning. So there became this conversation, well, we can't get it, right? And so that was the realization and understanding that communication, especially the health communication, risk communication, was not reaching the corners of the world that they needed to get to, right? So I think fast forward 2+ years now, we are well aware of the issue. And quite frankly, it's time to stop talking about the issue because we all know what it is, right? And so we now have to move into action in order to address it. And so you have to understand, even if I use that same example, what did we not have that we needed to have? And how can we put that in place? Who do we need to reach to first?
Right.
Because if you reach to those, and that's whether it's care delivery, communication, no matter what, if you reach to those who are at highest risk first, even indirectly, those who are at lower risk will also benefit.
Can nurses lead the way in trying to fix some of those problems?
Now I'm a little biased, right? So I absolutely believe that not only do nurses or can nurses lead the way, but nurses should be designing and developing the way that that should happen. You know, as I said, you know, in my remarks, we are the subject matter experts in how people experience life. Because health and wellness is life.
That's so true.
So we have that ability to understand. And, you know, I talk all the time about, you know, we used to do care plans in school, right? We used to create our nursing diagnoses, and then we would know what to do in that unit on our clinical rotation. Imagine if we brought that into practice. Imagine if you leveraged what you know to be true as a nurse and operated from that place as opposed to waiting for some other direction from another colleague in healthcare to give you permission, right, real or imagined, to practice as a nurse. So I absolutely believe that nurses can, nurses should, and we should make sure to create those spaces and places so that each individual nurse believes that they can.
Right. And I so salute you and your leadership and what you're doing within the federal government domain. I also want to shout out to my colleagues here at AARP that are involved in the Center to Championship Nursing in America for all that they're doing, mentorship programs, working with people just entering in the profession. But, you know, to talk more about nursing and the profession, not only, as you just mentioned, I think they can play a real key role in over time. I don't think this is a short-term solution at all, but reversing the inequities that we see in the healthcare system. And for no matter what most impress is not the right word. What most depresses me about the situation is that it is regardless of income status. It clearly is structural racism at work. So I'm glad to hear and to see that you feel that nurses, and I also believe as a non-nurse, but as a consumer, that you're right, that they can play a key role. That also leads me to my next set of questions, though, about nurses are sort of at risk, right? Because their role is expanding. It almost sounds like, and this is a personal motto sometimes for the people in the room who will hold me accountable, that I like to ask forgiveness, not permission, but you can't always do that in a healthcare setting. I'm sure it creates stress, and I was listening to a talk of yours that you gave earlier this year where you said you really, I forget what you said, but you focus on how are you doing. So how are nurses doing? I'm sure there are issues around burnout. You know, they're trying to expand their role, but not every setting wants them to expand their role. And as I said, in a healthcare setting, I don't imagine you can ask forgiveness a lot because people's lives are on the line. So how are nurses doing?
Nurses are tired. As I've had conversations over the past 3+ years now, I've had conversations with student nurses, I've had conversations with staff nurses, chief nurses, healthcare executives, prominent leaders in our profession, and everyone shares that sentiment, right? And whether it's physically tired or it's just mentally and emotionally, right? So
Are you seeing the attrition that some other professions are seeing?
Oh, absolutely. Absolutely. But I think, many times people focus on the fact that people are leaving, and what they don't focus on is why, right? Because people leaving, whether it's resigning or for us in the Commission Corps choosing to retire earlier than they had intended, that's a symptom.
Right, absolutely.
Right? And as nurses, we don't just go around treating symptoms without any focus on the actual process that's causing the symptoms. So likewise, you've got to look at what is driving people out the door, and you need to change that. The world that we lived in, right, because we'll forever have a pre-COVID and a post-COVID world, right? So in a pre-COVID world and what healthcare looked like, that's not now, right? The people who were in the nursing workforce then are largely not going to be now, right? So in the next coming years, we will see a new generation of nurses, and that's a conversation I have all the time, because you have to understand that the new generation of nurses, the new generation of our health workforce, of the workforce in general, are coming with the notion that, what's in it for me?
Right. Justifiably so.
Right? Right. And I say, rightfully so. Why should I work myself to my last breath to crawl home just to do it again? And tell me again why you think I should do that, right? So we have to begin to ask ourselves, why would we and why should we expect that of nurses? So for me, from day one, I've always come with the sense that nurses should have a voice, right? So nurses should have a voice, nurses should have a seat at the table, nurses should bring a chair if there's not a seat, or create your own table if there's not even a space for your seat, right? And so what that means, though, and I tell the leadership in the Commission Corps all the time, I'm creating some vocal nurses. Are you ready for them? Right? Because they're coming. And I dare say across the nation, we have a shift in the tide of nursing because now nurses have seen how valuable we actually are. Right? We don't often stop to pat ourselves and each other on the back. We need to do that better, right? We need to do more of that. But now that you see what happens to a healthcare system when the nurses are not operating from all cylinders, now nurses have found this leverage and understanding. What we have to do collectively, though, is to be able to express that and explain it. Across your organizations, walk up to a nurse and say, hey, what do you do? Oh, great. What is it about being a nurse that helps that? Some people answer that easily and some people struggle. So we have to do a better job of helping people understand what it means to be a nurse and the value that you add, and it's not less than what someone else might be able to bring.
Let's talk about the role of the federal government and your office perhaps in making, so I'm really intrigued, and I hadn't thought about it and didn't have the knowledge that we're going to see a major shift in the composition of who the nursing force is. So a great challenge, but also a huge opportunity for us and for those of us who are worried about the state of the healthcare system. What is your office, what does your office do to help sort of make sure that this new force of nursing gets used in the right way in the healthcare system to fight health inequities?
Got it. So as a leader, I lead by example, always, right? I've worked for the past 15, 16 years in Washington, D.C., square in the mid of everyone's headquarters. What I have never believed is that I can sit in Washington, D.C. and tell you what you should do and how you should do it elsewhere. And so what's important to me is to understand the lived experiences of people, right? So as a policy person, I tend to create policies, and that's, with every resource, the sun, the star, the moon, everything's aligned. This is how it works. What I rely on are those outside external conversations that say, well, not here. That's not how it works here, right? But then it becomes a conversation of how can it look there? And what does it look like? What's in the way for you? What do we need to do differently? And so those are the conversations that we then take on within the federal government in different places and spaces and divisions, and as we call them, staffing divisions and operating divisions, to understand how can we create what will support the drive, right? I also always want to clarify that the federal government does not mandate anyone to do anything, right? We can leverage with funding, right? I've got HRSA colleagues
So
here.
my taxes are optional, is that what you're saying?
No, let's not get that on record, right? But what I mean to say is, there is not a place and space related to nursing education and or practice that we can make a school do something, make an organization do something, right? And so we can influence, we can share best practices, right? But I always call it flexibility within boundaries. Because again, we can design what the larger big picture looks like, but we've got to allow at the local level, at the tribal level, territorial level, for those nuances to really address the needs. Because again, this is what nurses do. We never come in and tell someone how to live their life. We say, hey, how would you want to live your life? How can I help you achieve that version that you call your best life? And so as the federal government, as the chief nurse, that's the conversation that I have. And even internally within our own service, you talk about the changing tides, right? We'll see the same thing within the Commission Corps. And so what's important to me is to make sure that even the newest nurse knows that they are still a professional in their own right, right? Your rank might be lower, your years of service might be lower, but how about your ideas are probably more innovative than those that have been around for quite some time. And we have to adopt that same philosophy so that we embrace newer nurses and how they choose to practice. And what we can't do is say, well, when I was in school, or when I started practicing,
we don't do it that way.
Because no one cares.
That's a good,
and so we've got to stop imposing that on others, but instead be open in understanding, well, how is it that you'd like to? And what do you see happening from that? And now, if there will be a negative impact or outcome, it is on us to explain, but then it's also on us to help mitigate it, not to change the approach, but to help them mitigate it so that their approach is still valued, it's still embraced, and implemented.
Great answer. And given all of that, and the fact that you were an influencer, not a mandator, do you think, I'll use an arbitrary, either 10 years, 20 years down the line with this new generation of nursing, and I know that we have to wrap up soon, so this may be my last or next to last question. Is the future of nursing browner, blacker, more diverse?
The future of nursing is bright.
And more diverse. I said brown or black as examples, recognizing that the diversity sphere is large and wide. LGBTQI plus, disabled folks. Is it more diverse?
I think the future of nursing is more inclusive, right? And I say that because what I mean is the population of this country is going to shift, right? So the demographics of the country will shift. And we are a part of the country, right? And so as the population, as the impacts, issues change and move across the country, we are just a microcosm of that. And so as we strive to match the changes in the country, we have to assess when we're falling behind or when we're doing a good job. Because if you're doing a good job, it's on you to share that so someone else can turn that into their good job. So I do believe, and I do hope, and it will be my eternal goal to continue to diversify the nursing workforce, and that does include more men in nursing, because oftentimes we talk about women in the workplace, but for nursing, we need to increase the number of men and those who do not identify as women.
Last question, I think we have time for. In your leadership role and looking at the participants both in the room and who are joining us virtually, who are all part of a partner pool, what recommendations or suggestions would you give to people who want to partner with you and with CCNA and those who are looking at nursing and how crucial this profession is to health equity in this country? And we do have a ways to go.
Right.
COVID really showed us that. What do you say to the folks attending here in terms of their role, what they can do?
Got it. I think every single one of us is in contact with a nurse somewhere, somehow, in some shape or form in your life, right? And I think it is on you to understand the lived experience of that nurse. And I would challenge everyone to understand the lived experience of a nurse that you do not already know. Because I guarantee you that shedding light on that experience, both personally and professionally, will be insightful. Because what we have to do a better job of is creating this authentic self so that people don't feel that they're kind of, I'm a professional nurse, but then I'm also a mother. No, I'm a professional nurse and I'm a mother, right? And so we've got to do a better job of allowing people to be who they are, to show up as who they are, and to build that into our actual culture. So I think, when you talk about partnerships, I think it is to honor, to celebrate, to acknowledge nurses everywhere and wherever you have a level of impact, because it could just be someone walking down the street and you find out someone's a nurse. Honor that person. If you're at the highest level of leadership, where are your nurses? What is the contribution from your nurses? Make sure that not only the nurses know that that's happening, right? And so I think that that's what it is, because across the country, nurses are not feeling valued, are not feeling heard. And we need to turn that on its head. And I always say, and not buy a pizza party.
Right. Such words of wisdom. Thank you so much. This has been wonderful. Thank you for your adaptability, for your unflappableness, but also the words of wisdom that you've shared with us. It's really been very revealing to me, and I've enjoyed it. Thank you so much.
Thank you.
Your Admiral MIX.